Here we are. Is Stenny? Did Stenny get here? I need to tell you something. Mr. Hoyer will be here shortly. Good morning. It is with great pride and even more humility that we come together today to enroll this important legislation. In doing so, Congress will act, as others before us did, to do something very important for the American people, very significant to their daily lives. Others before us brought forth Social Security, Medicare, the Civil Rights Act, some of the landmark legislation in our country's history. And today, we have the opportunity in the House to sign this legislation, to enroll this important legislation, to send to the President of the United States for his signature. We calmly review the events of the last week or so, which brought us to victory in passing the base bill, the Senate bill. Essential to its passage was the passage of a second bill, which would make significant improvements on the Senate bill. Only then would we be able to pass the Senate bill. A matter of trust between the House and the Senate, we were able to pass the Senate bill here, knowing that the Senate would pass the House improvements. Senator Reid did a remarkable job keeping everyone together. We were thrilled yesterday to see a very substantial victory for these improvements. What happens now is the result of the work of many people. You've heard me sing the praises of our leadership over and over again, and of course, the President of the United States. But the victory that we have is largely attributed to our newest members of Congress. We've had generations of working on this legislation. Mr. Dingell, what an honor it is to serve with you. You have been our inspiration. And his father before him. My father served with Mr. Dingell's father. His father before him, introducing every term in Congress universal health care for all Americans. And that legacy, that tradition, was reinforced with the election of our in 2006 and then in 2008 to increase our ranks, to strengthen a Democratic majority, to pass this legislation. Not only was it about the numbers, more important than that, it was about the significant improvement in the legislation. Because of some of the members who are here and their colleagues in the class of 06 and the class of 08, the legislation that we enrolled here today makes this health care reform more affordable for the middle class. It makes it more accessible to many more people. It has more equity for the states by removing the Nebraska arrangement. State equity. It makes it holds insurance companies more accountable by improving the reforms that were in the original legislation. It changes, because of the work of the 06 and 08 classes, it changes the pay for, making it fairer, again, to the middle class. It closes the donut hole for seniors, and that's really very important. If you're not a senior, as I am becoming even more and more one by the minute, the donut hole is the disparity, the inequity that seniors face in terms of paying for their prescription drugs. So again, more affordable for the middle class, more fairness to the states, more accountability for the insurance companies, better pay for in terms of the middle class, closing the donut hole. Something that captures why this is so important came home to me last night when I was reading some letters. Listen to this. Cindy Mercer Jones Wynn wrote, "My beautiful daughter, Courtney Leigh Huber, 23 years old, died on January 5th, 2010. just a matter of weeks ago. She was an insulin-dependent diabetic who was kicked off her father's insurance the day she graduated from college. She wasn't able to find a job that provided insurance or even a reasonable income to buy her medical supplies. I helped her financially as much as I could, but being a teacher and single mother of 5, my income was also limited. To try to conserve her insulin, she attempted to wean herself off her nighttime insulin dosage, resulting in ketoacidosis. She slipped into a coma and never woke up. 23 years old, no health insurance, unable to afford her full insulin supply. Now when this legislation is all signed, sealed, and passed and into the law, Courtney Leigh Huber would be able to stay on her father's insurance policy until she was 26 years old. This makes a tremendous difference in the lives of the American people. Another important part of this, past the President's budget last year, 2 of the pillars of his economic stabilization and job creation were investments in education, investments in health care. When we did the reconciliation, it was on a dual track. And thanks to the leadership of George Miller and members of the Education and Labor Committee, many of whom are present here today, this education piece is in this reconciliation. On any given day, this would be an enormous victory for the American people. Lower the cost of student loans, 8 million families affected. Improving the Pell Grant for many people who need Pell Grants. Assistance for community colleges and historic $2.5 billion for minority-serving institutions, making college more affordable for the middle class and reaching out to make it more accessible for many, many more people. It's about training our workforce in our community colleges. It's about, again, reducing the cost of student loans. Thank you, Chairman George Miller and members of the Education and Labor Committee. Dale Kildee and so many members of the committee. Who else? Rob Andrews. Carol. Well, I'm going to introduce the other two here, but on that committee, Rob Andrews and Ruben Hinojosa chaired the subcommittee that did the minority serving institution. I don't know if Ruben is here, but he's been relentless on this. That's why so many young people are here today. Their lives are affected by this legislation, not only in terms of staying on their parents' policies, but being able to afford their education, and again, eliminating a pre-existing condition. Being a woman, for example, has been one up until now, but not now. It's important to note, and Steny would want me to make this point very strongly, that all has been to every step of the way. In the education piece, we saved $10 billion for the taxpayer. Overall, we save over $1.3 trillion for the taxpayer. So this is about improving affordability and access. Again, more affordability for the middle class in terms of health care and education, but to do so in a way, that saves the taxpayer money. And when it comes to our seniors, we protect Medicare and make it solvent for nearly a decade longer. We close the donut hole, and we have a better situation for preventive care in the legislation. So if you're young, if you're middle-aged, if you're middle class, whatever your situation, this legislation affects you very directly.